Welcome everyone. This is our first masterclass, and really this is going to center around in the treatment room. So the objectives here will center about us talking to patients, really how we're talking about PDRN treatments, these adjunct treatments with our microneedling modality. If you would all like that deep dive, high-level information when it comes to how polydeoxyribonucleotides bind with the adenosine receptor and help expedite DNA repair, there is a previous webinar with Dr. Martin Braun of the Vancouver Laser Institute, and that link is available on our website. So if you want that deep dive, certainly on vegan versus salmon PDRN, certainly check that out. But today, we're really going to be, like I said, focusing on the story in the treatment room, how we're talking to patients about PDRN adjunct treatments with microneedling. And then more broadly, the EXO Longevity Protocol and incorporating the GloXO into this three-step system. And then we have, again, reiterating that treatment story and really incorporating them into treatment systems and not add-ons, because we all know about the add-on paralysis. You get your regular microneedling clients in the door, and then you mention GloXO, additional charges, rather than packaging it together as an intended outcome or a goal. And so that's really how we're going to be positioning it. And then also, too, with induction therapies, with collagen pin and induction therapies, we are named after that scientific percutaneous induction needling, that root scientific definition of inducing collagen via microcontrolled injury, which is the modality, yes, but also that topical environment. And just like us, when we are in different conditions and circumstances, whether we thrive or fail, our conditions, our environment is everything. So we're really going to be putting an emphasis on how our microneedling modality changes when we change that topical environment. So getting into that EXO Longevity Protocol, it exists for 3-step program. So this is going to be the directly post, the Repair XO, RXO mask, and the in-office GloXO. Both of these are going to be in the treatment room, and then you will send them home with the vegan PDRN, the YouthXO. So deeper dive into what comprises GloXO. It starts off with, of course, the driving force in this regenerative topical, which is going to be the 5% salmon PDRN. Other companies, they offer those 1s and 2s. We are offering a concentrated 5. That's something we pride ourselves at in Induction Therapies, is always giving you the highest concentration of those unique actives. So we also are combining it with the exosomes as well, the plant-derived exosomes. Really what these PDRNs break down into is the raw nucleosides and nucleosides that are essential for DNA repair. And the reason why we like using them is because they do have that strong biocompatibility with human DNA, which is set to lower all the chronic markers of inflammation, which is going to present in the skin as soothing redness, erythema post-treatment, as it boosts that rapid skin recovery during the wound healing and proliferation phase. Of course, our chosen exosome is the Centella asiatica. This is also known as gotocola, tiger's grass. It has many names, but it's actually become rather popular in our aesthetic space when it comes to a plant-derived exosome for its high body of literature on its anti-inflammatory properties. So continuing to bring down that skin inflammation to help it in that wound healing proliferation phase. We do put soluble collagen, which is derived from salmon as well. And so that is going to further drive that extracellular matrix transformation in the fibroblasts. And then, of course, in that carrier of that bed of sodium hyaluronate, which is so crucial in our extracellular matrix and our connective tissue for plumping and getting that radiance, that hydration. It's such a key driver in that topical environment. Now, the way I like to talk about PDRN is, in understanding it, is that, and you'll find this connects really well with the previous webinar with Dr. Martin Braun, is that we have raw nucleosides and nucleosides, which are those building materials that show up to the work site. They're ready to build our walls. They're already furnished for us. Whereas, on the other hand, we have time. And so time, especially as we age, it becomes rather laborious for our cells to make their own bricks, per se. And so that's the reason why we will have these raw nucleosides and nucleosides step in, because without them, we're just going to be relying on time, which is on the skin post-treatment going to present a lot differently than if you did have them, which we're about to see in some of my more recent treatments, is that when that snowball cascade effect of the inflammation response is allowed to do so, you do get a lot more of those more robust transformation signs, which is that deep peeling, which some like that, but if your patients are going for a more streamlined, smooth recovery, because it's all about recovery. So in the office, we will have the Repair XO, the RXO mask. This is a modified formulation or a step-up formulation from our best-selling exosome facial mask. This is going to have that copper tripeptides, the Centella asiatica exosomes, along with the salmon PDRN. And what you'll find that the reason why we use salmon in the treatment room and vegan in the post-care, home care, is because the salmon, and you'll find this off with Dr. Martin Braun's webinar previously, is that it has a negative charge and a larger molecular mass, so the stratum corneum does want to repel it, so it does benefit with the aid of those microchannels, whereas the vegan has a positive charge, lower molecular mass, and benefits to pass the stratum corneum without the aid of those microchannels. Going into the YouthXO, this is going to be positioned as your home care. It really is that one and done serum when it comes to the dual repair. It does have the vegan PDRN along with the exosomes in a bed of squalene and phospholipids. And if you've ever used squalene post-treatment, it's extremely deeply moisturizing and hydrating, so you're likely not even to need an emollient moisturizer on top of that to make you feel comfortable. So just more recently, how this presents on the skin, this was literally last week in one of my most recent treatments, and it was a maximum 3 millimeter depth treatment on the lower face and the neck. Because really, once I was past a lot of my acne scars, I'm really interested in pushing collagen pin towards that subdermal remodeling and really seeing what we can affect with it, and especially how robust this post-care is. So just directly post is the first picture, and then of course, the Repair XO mask is applied, and then just 20 minutes later, we see just how much of that post-inflammatory erythema has been reduced. And the reason why I also like using the masks as well is because our environment is part of the treatment. We're modifying that environment. Other microneedling modalities and companies, they put their glide as like a hydrogel, which they'll take a 4x4 saline gauze and remove that environment post-treatment. I've seen it done in many demos, and you really see that skin start to get a little irritated. It's red, it's flushed, they feel warm. And so this is really gonna take away that flush warm feeling, which is a sensory experience for the patient in the treatment room, which they're gonna remember. But it also is keeping all of that pinpoint bleeding, all their own fibroblasts and growth factors in that mask, which is going to help their transformation further. We're not wiping away any of the good stuff that we've just used as our topical environment to glide. And then you see that last picture, which is really past that application, that post-application, same day. This is like within a 45 minute time frame. And I've applied the GloXO after the mask along with the YouthXO, and we really see a difference. So why would you use both? It's because you really want that sensory experience. You want to cool the skin, because especially with those more heat-sensitive skin types, we want to cool and bring down the temperature. You've felt it in a treatment, is that whenever you put on that topical numbing, you already feel like the degrees in the room has already went up a few. And so post-needling, if it were 68 degrees, it's now 76 degrees in the room. And so we really want to bring down that temperature. The patient will appreciate that, but so will their transformation. They get to leave the office, like this last picture, with little to no erythema and redness. And now the next day, you're seeing that day 2. I was using GloXO. So in the GloXO, you will have enough for an in-office application along with the first 48 hours and the next 2 applications post that treatment. So they can really get to, in that first 24 to 48 hours that those microchannels are closing up, the benefits of that salmon PDRN. So then we see day 3, still using that GloXO and YouthXO. And then by day 5, we're just using the YouthXO and an SPF, a suitable SPF. And we're seeing such great results. Again, what we're seeing, this was a pretty aggressive treatment at 3 millimeters. And what we saw is that we're really maintaining that skin's integrity from the first day to the last day. That was just a detail going into the Repair XO mask, just isolating that. And now we're going to get into how it works, the EXO Longevity Protocol and how it works. This is really how we're going to be talking to patients and clients, because we all comprehend our lives, our whole world, in the way of a narrative and a story. So they need to know what PDRN is going to do for their transformation in their extracellular matrix so that they can make the decision to take it on. And so we're really going to be equating resistance training to your microneedling. And so you can already probably see where I'm going with this. Every time we resistance train, we have to take steps of recovery, because after an injury, the steps we take post-injury are crucial to that recovery and the longevity, because that's really what we're aiming for. It's not just the recovery, it's about what continues to happen in the weeks and months after that recovery and leading up to our next treatment. And so, of course, post workout, what do? Everyone normally always kind of, if they're coming into your clinic, they're aesthetically minded. You're probably even connected to a wellness biooptimization bent in your clinics. And so, what do? We need those micronutrients. So, we would never skip our protein or our amino acid shake after our workout because our muscles have been injured. They need those micronutrients to recover. And we're most likely, whether or not you're a fanatic about supplementation or not, someone's always taken something, whether it's a B complex, a vitamin D3, what have you, to really help that protein synthesis in our muscles. And then if you're really up on your biooptimization and you're really trying to get that mid spike of adrenaline and cortisol to help jumpstart your recovery, you're doing a cold plunge. And so these steps can directly overlay into our treatment room so that we can talk to our patients that when we do, they are understanding and comprehending, oh, I see. Like if I didn't use my protein, if I didn't cold plunge, if I didn't use any supplementation, I just went to the gym, I'm going to tone up, but my recovery, I'm going to be sore for like a week. I'm not going to be able to bounce back. I'm not going to be able to hit the gym again. I'm not going to be able to start using my actives, my retinols, those collagen stimulating building blocks again until I've fully recovered. So we really want to get back to our actives. We want to stay active. And so in the treatment room, post microneedling, that recovery, same with the GloXO, is that it's going to be providing that skin with the raw nucleosides and nucleotides with the building blocks for skin repair. And then we have that RXO as well, that instant gratification, that system reset post-treatment so that they can leave the office with little to no erythema. And then we have that nourishing bed of squalene, phospholipids, plant-derived exosomes, and the vegan PDRN. It's going to keep our skin elastic and radiant and also minimize those visible signs of treatment and social downtime. So to draw those conclusions, those connections, it's not a far leap when we're in the treatment room talking to our patients because most everyone understands recovery, especially as it pertains to the gym. So just drawing those direct connotations over to the GloXO, the RXO, and the YouthXO. And so now we're going to get into how to book it. This is going to be more on the business side, the ROI side, and I want to hand it off to my colleague, Madelyn Cusimano.
Okay. So really what we want to focus on here is now we know how it works, why we use it, all those great things, but what we don't want it to do is sit in your back bar or sit on your shelves. So how to use it, how to book it. So really turning GloXO into a revenue system. We really want to help practices increase average treatment value, patient outcomes, patient retention, and really package the sale and creating a whole system for you. So we really want to get away from don't just sell the product, we want you to sell the treatment experience. So patients don't want another add-on, right? They don't want to be doing math in their head when they're laying and, trying to enjoy their treatment. So what they want is the experience. They want a faster recovery. They want better healing. They Can you go
Sorry.
back a little,
Yeah,
Justin?
sorry.
They want better, that's okay, better
Trigger
healing,
happy.
more radiant skin, and they want longer lasting results. So positioning GloXO as part of the treatment and not another ticket on their receipt, right? So how that goes is, we really want to avoid that add-on paralysis talk. So I don't know if you've ever been in the treatment room. You're really trying to sell all these different things, right? We're like, do you want the LED light for 25 or 75? Do you want, an add-on mask? Do you want the GloXO? All of these things. And all we're doing is sitting there, the patient or client is trying to, and I can't calculate anything for nothing. So I would need to bring out my phone, try to figure out how much that all costs. So that is going to create a paralysis. It's going to create a paralysis for your client to make a decision on if they should. And to be honest, you're the expert. So you really know what the skin needs. Why give it to your client to figure out if they should do a mask or if they should have an LED light? That's up to you. So we really want to sell, instead of doing microneedling plus the add-on talk of 250 for the GloXO, we want to package it all together and you let the client know what they're going to get, right? So you're going to be like, hey, you're going to get a microneedling treatment. We're getting the GloXO. You're going to get a mask on there. And then, of course, you can recommend the YouthXO serum for take home. So this is one premium experience and a higher perceived value, but also you're taking away that add-on paralysis. So it's a package deal. We really want to see practices creating signature protocols based on their client's need. Again, instead of that big mistake of just offering, plus 75 for mask, LED 40, 50 for a serum. Patients stop listening because, again, they don't want to do the math in their head, nor do they really know what's best for them. You do. So let's create a complete treatment experience by really diving into their needs. So let's build these treatments around goal-centric menus, right? So they're concerns instead of products. So are we looking for healthy aging and longevity? Are we looking for post-procedure healing, recovery and repair, tone and texture, pigmentation, acne and blemishes? At this point, we've now already naturally added all of the GloXO in multiple protocols. So all of them are candidates for the GloXO protocol. So really, and again, we love storytelling. I'm a big analogy gal. So really just trying to help your client understand the importance of the GloXO experience. Because if you worked out, would you skip your protein afterwards? These are questions that you can ask so they can start to relate to it. If you renovated your home, would you skip the painting? So really understanding what microneedling and all of the steps afterwards mean, because microneedling creates a controlled stimulation. Like the recovery is where the transformation happens. So yes, you can microneedle, but it's truly what you're microneedling into the skin and how you're taking care of your skin afterwards is what really is going to set you apart from the results that you're getting with your clients versus the person next door or down the street who's not using anything that is really inducing that repair and that recovery. So what we're trying to do, of course, is always increase retention. Retention being patients who purchase protocols are more likely to return to your business, purchase packages, purchase the home care, and then trust the treatment recommendation that you as the expert is, you know, implying into their skin and their lifestyle, right? So we really want to do package for success, right? So always offering series of 3 or 6. You could even do membership pricing for this and include XO on every visit. There's literally not one person that shouldn't have a GloXO with their microneedling. And again, we really want to avoid asking at every appointment, would you like to add a GloXO today? Because again, they're not the expert. You are. This protocol always includes GloXO because it's part of your recovery system, is the language that you should start really using in your practice and in the treatment room. This is just a snapshot of what revenue you can bring in by doing a GloXO microneedling. So GloXO with microneedling. So if you're doing 10 patients a month and you're charging 550, you'll get a 5,500 revenue. The cost of the GloXO is $66 a vial, so that's 660. So you're seeing per month 4,840 extra money just from doing 10 patients. And that's like minimal. So, of course, it goes up, right? Now, if you want to see the return on investment for just the GloXO, 10 patients, that's $250 technically in our head, even though we're not separating it. So that's $2,500 a month, an extra 1,840 additional profit just for those 10 patients. And again, if every patient can use GloXO, you're really seeing that more in that 40. So really your take home just from the GloXO would be 7,360. And if you're adding it, of course, we're doing it with the system of the microneedling, that's closer to $20,000 a month. So same appointment, because you're not taking up extra time. It's the same chair time, and now you have a higher treatment value. So really the takeaway from GloXO microneedling is don't sell the GloXO on its own. Build a system around it, create the protocols, which I can help with, name your experiences, sell your outcomes, increase patient satisfaction, and increase treatment value. The practices seeing the greatest success aren't asking patients if they like to add on a GloXO. They've built it into a premium treatment experience that patients expect, value, and return for. And again, we're avoiding that add-on paralysis situation. And I always say, and I know Justin's going to laugh because I love talking about the burrito concept, but like, let's say you're building a burrito at Chipotle, right, or wherever, and you're getting excited because you're adding on all these things, and then all of a sudden your $8 burrito, they say, if you want guacamole, it's $2 more. And you're like, uh, uh, do I want the guac? Do I not? Because you're thinking about that $2. Now, if I showed up and the burrito's already made and the guac is already in there and it's $10, I'm going to buy the $10 burrito because again, I'm not having this okay, it's extra cost sort of. I'm like, look at me. I got the Supreme because I deserve it. So really just avoiding that, paralysis is where we're going. And then really giving you the repair and the recovery that your clients need to have these insane before and afters that you deserve and so does your patient.
Exactly. Thank you, Madeline.
Of course.
So that being said about the EXO Longevity Protocol, it's time to bring it on. And so this month in August, they are offering a buy more, save more, or buy more, get more, which is the bottom tier is the lowest investment is the buy six, get six units. And so you'll be buying the aftercare, purchasing the aftercare of the YouthXO and the RXO in-office mask, and you'll be getting the GloXO syringes for free. And this special is stackable, so if you buy more, buy 12, you get 12, 24, 24, 48, and so on. And so also, this month, with all August orders, it is coming with the branded GloXO and collagen pin merch. We love these just because whenever you're filming content in your treatment room, we know that you're proud of your collagen pin. We're proud of ours too. And so we always want to show that off in any way that we can. And so it will be coming with merch for all August orders. And now, if you are wondering about all of the resources, there's front of house, back of house, there's front desk signs and provider protocols that are available to download. Just contact your rep for those. So yes. And then also too, like Madelyn said, she loves doing the protocols and really helping you be successful in your treatment rooms because she's been in the treatment room herself. So if you want to schedule a practice success meeting, you can do that with Madelyn Cusimano. And now, with that, we will open it up to the floor to a brief Q&A before we close out today. So get all your questions, and then Madelyn, if you could, since my screen is up, if you could moderate and pull up those questions, it should be in the Q&A section. I wonder if we have any already.
Just in the chat, correct? Yeah.
It might be a Q&A section. I'm not quite sure. I haven't looked. You know how software updates all the time.
Yeah. All right, let's see. No questions? We were that good.
There you go. Thorough. We'll give it a second because maybe they didn't
Okay.
know that a Q&A was coming.
Yes.
Nice. Well, it also, we are in the middle of the day too, so that time could also, maybe they have us on in the background, in the lunchroom, in the break room.
In the lunchroom.
In the lunchroom.
Okay. Well, I don't see any questions coming in. However,
Okay.
if a question pops up, feel free to reach out to your rep or to any Justin or myself. And then again, this is our first of many, so we're going to be doing these once a month. And wait, we might have. Oh, wait, we got a question.
Ooh.
Okay. If starting a new practice, then how would you recommend proceeding to start?
rather
Well,
broad.
yeah. Well, we can definitely help, if, in terms of bringing the GloXO in terms of collagen pin, we can definitely connect you with your local rep, and we could definitely get started ASAP. So
Right.
if you want, you could definitely reach out to our home office to see who your rep would be, and happy to help you with that. And I can also contact you on the side as well.
Yes, and you will have in this follow-up email that you'll receive for attending, there is a link to schedule a business success meeting with Madelyn.
Yes. And then also too, all of these slides and stuff like that are going to be sent to you in a link emailed to you. So you can rewatch these slides, as well as have our contact information, as well as having the link to schedule any business meeting that you would like with myself. Included in that business meeting is obviously building out protocols, menu diving, how to really adjust your menu. So again, we're getting away from the add-ons and then just building experiences. And this could be experiences as well with any other modalities that you have. So whether you have, a hydrofacial, a glow 2 facial, a laser, anything like that, I can help you build out packages with obviously our microneedling and our topicals that we have. Because not only do we have GloXO, we have 82 other SKUs as well. Um, Okay, well, this has been so awesome. No other questions are coming up, just people sending us love, which is great.
Perfect.
Thank you.
We love that. All right.
Yeah,
So thank you again, everyone. We will be back again in September for our second masterclass. We're going to be trying to do these monthly, just as it coincides with all the different topical environments that Induction Therapies offers. So do tune in next time. And the registration page, if you signed up on the landing page, there should be our next topic will likely be posted there as soon as it is finalized. So thank you all again for your time and attention, and we'll see you next time. Thank you.
bye.